Thank you for this great introduction. I want to say hello once again to our guests and to our Sisi family. I'm so happy to be with you after all these years. I think it's... Can I continue? No? Maybe I should turn something? Okay. Yeah, I can continue. Is it? We don't have echo anymore? Okay. So once again, greetings for all, for our guests, for our Sisi family. I'm happy to be here with you. It feels like decades we didn't see in person. I'm happy to be here. Okay, I will not give you a presentation on the screen. I would like to talk with you on. Is everything fine? Yes. Yeah? Okay. So I would start the speech with the right to health is fundamental right. And I would quote now World Health Organization, which state, the right to health for all people means that everyone should have access to the health services they need, when and where they need them, without suffering financial hardship. So we can talk about this, but also I would like to quote a Lancet article from 2018, where they state that during 2016, in 137 low and middle income countries, 15.6 million of excess deaths occur. So we had a problem even before pandemic. I would like to discuss a little bit about these problems. So out of that 15 millions, more than 8 million excess deaths were amenable to healthcare, of which 5 million were estimated to be due to poor quality care. So we are talking about, just in purpose of comparison, we are talking about of size of population of Austria. Poor quality of healthcare was a major driver of excess deaths even before pandemic.
It's okay, we can hear.
Oh, thank you. Okay. Okay. So, as I said, poor quality. This is strange now. Poor quality of healthcare was a major driver of these excess deaths. So, what is the conclusion? Conclusion is that countries should strengthen their public health system. Our healthcare system should be on a foundation of public healthcare and universal coverage grounded in human rights and equality, what we are talking about all the time. So these numbers that I mentioned, all of these numbers worsened during the pandemic. So according to Institute for Health Metrics and Evaluation, also Lancet article, Lancet Commission, they stated that as of May 31st, 2022, there were 6.9 millions of reported deaths, but 70.2 millions estimated deaths from COVID-19. This staggering COVID deaths toll is a result of massive global failure. Governments fail to build a social trust, reflecting to the public opposition to routine public health and social measures. Failure in one country is a failure for the whole planet. That is what we learned from infection disease, yeah? So, therefore, pandemic require more solidarity and coordination so that poor countries could find needed resources to treat, isolate, and combat serious epidemics. So, high mortality rate affect not only low-income countries, but high-income countries. And I would like to mention the United States here. In the United States, death rates from COVID-19 are higher than in any other high-income country. So we are talking about biggest economy and one of the wealthiest country in the world with wealthiest healthcare system, they would say, yeah? According to the Yale School of Public Health study, more than 300,000 people could be live now in United States if they only had universal health care, but they don't. Not only hundreds of thousands lives would have saved in USA, but only $105 billion due to hospitalization expenses just in 2020. So humanity has witnessed outbreaks through the centuries. Unfortunately, COVID-19 pandemic won't be the last, yeah? So we need to learn, and we have to learn what we have failed to achieve during the pandemic and years before it, and how to avoid these failures. So I would quote one wise man: if you are not willing to learn, no one can help you. If you are determined to learn, no one can stop you. So as for Montenegro, we are improving slowly, but in some areas we succeed finally. So I would mention some of those successes. Our trade union did not wait for institutions to conduct analysis on the lack of staff, insufficient financing on healthcare systems, and the outflow of doctors that Klaus already mentioned as our main problem. We did them ourselves, and we were the main source of this information in our country. So COVID helped draw attention to the importance of strong healthcare system and the importance of healthcare workers, as Esther mentioned already. So since the beginning of the COVID pandemic in Montenegro, the growth of private health institutions and outflow of doctors from the state health system to private ones has been happening and increasing. According to WHO data, Montenegro is the country with the highest out-of-the-pocket spending, which is around 40% of all budget determined for health. The number of doctors in Montenegro is 3.2 per 1,000 inhabitants. The EU average is 3.8. In order to reach this average, we need around 365 doctors, or 80% of total number of doctors in Montenegro. In just 5 years, over 200 doctors left the state health system, which is 11% of total number of doctors in the state sector. In order to prevent this trend, in the past year, our trade union managed significantly to increase salaries and to slow down the outflow of doctors to the private sector. We are only union in our country that succeed to increase wages by 100%, finally. Now we are proud to announce that the average physician salary in Montenegro is around 1,800 euros, or 2.5 average salaries in our country. We managed to introduce and define a new criminal offense into the criminal code of Montenegro: assault on doctor at work. An attack on doctor in the workplace endangers not only the safety of the doctor, but also of all patients he cares for and to whom he provides health care at the moment. But the hardest part of the job remains: raising the quality of healthcare system, the state from the beginning. Yeah, I already told you. Fighting for better education for healthcare workers and introducing and achieving the standards of modern medicine should be our goal. Such a well-rounded reform will create a promising environment in Montenegro healthcare system for which one does not leave, but to which one wants to come. And that's it. Thank you.